Hello, I'm Jane Smith and I'm from the Pharmacy Department at North Bristol NHS Trust, and I'm really delighted to share our work on improving medicines reconciliation on admission at North Bristol. So to start with a definition, medicines reconciliation ensures that the medicines prescribed on admission correspond to those taken before admission. The process involves discussion with patients and/or carers and using primary care records as well as patients' own drugs, but is complex as information is not always easy to obtain and patients do not always take what their doctors think that they take. Research has shown that up to 50% of patients do not follow their prescribed regime, either intentionally or unintentionally. The work is important as in 2006 the World Health Organization commenced their High Fives programme and the Institute of Healthcare Improvement their Saving Lives campaign, both setting MedsRec as one of their work streams. In the UK in 2007, the Safer Patients Initiative also set a focus on MedsRec, and North Bristol was selected as one of only 22 trusts to take part in the Safer Patients Initiative SPI2. The impact on patients was highlighted by the National Patient Safety Agency, focusing on reducing harm to patients and subsequent avoidable increases in length of stay. The aim of the project was to improve medicines reconciliation and specifically to increase to more than 95% the number of patients receiving medicines reconciliation within 24 hours of admission. If you visit us at North Bristol and stand still long enough, we will show you our amazing run chart. This shows that medicines reconciliation is a complex intervention which takes time to embed by the gradual spread of work through phases to increasing numbers of wards and ongoing improvements. The first challenge that we faced was at the start of the project, as although we knew we were carrying out medicines reconciliation, we could not prove it, as we could not measure it. We liaised with the medical staff to introduce a medicines admissions proforma to instigate data collection. Ongoing challenges were to continue to embed and spread our work, so we ensured we involved frontline staff in PDSA cycles. We drove the project through the core team meetings with executive support and support from our clinical audit department, as everybody needs a Frank, to help display the results in a way accessible to all staff. As an example on the impact on patient safety, a patient brought to the emergency department, where there is no pharmacy service, was prescribed insulin. On admission, the pharmacist carried out the MedsRec and realised that the patient did not take insulin, and the prescription had been based on a handwritten sheet of paper left in the cubicle with no patient's name on. As a result of the investigation, one action was to ensure that all junior doctors shadow the admissions pharmacist to gain a better understanding of the impact of medicines reconciliation. Our run chart, together with quick benchmarking data, shows how remarkable our results are compared with other trusts, who in some cases have just started their journeys and only measure on one ward. We achieved our target in February 2011 and have since maintained and improved our results and are now trying to help others achieve the same. Thank you.